pursuing their residency program, especially 3 years training program, for them it is definitely that's for awarding for getting their certification for the 3 year certification for the that is most important for the eligibility of the fulfillment that is important for them. And definitely see when you a student a resident doctor completed the thesis, then that is a completion of his training program. So I request all of you to utilize this program very well. In this webinar, we would like to have the DNB thesis guidelines as per the NBE, whatever the approach, how to do the methodology and everything we'll discuss. So with a great honor, I would like to introduce today's speaker, Dr. Animesh Jain. He is the professor of community medicine at KMC Mangalore, Manipal, and also a deputy coordinator for medical education unit at KMC Mangalore, which has been recognized as a nodal center for all DNB faculty medical education by headquarters of New Delhi. And he has also has many research and ethics training programs for thesis writing for DNB students in ophthalmology at Shankara Eye Hospital Group of Institutes, Bangalore, Shimoga, and Guntur since 10 years. And he's also a reviewer of several reputed journals and even conducted several workshops to train and the building capacity building of doctors. I think I spoke to him recently. He told MBBS undergraduates also trained in research training. I was very much impressed actually. See, if the doctors were getting this knowledge from their undergraduation level, I think it will definitely inspire them to do a lot of research work in the future, definitely, which will be helpful. So over to you, Dr. Anmesh. So actually, what I want from the resident perspective of questions or whatever, we want to know what is thesis, why is this thesis, how to choose a thesis topic, how to complete it, how to present it. So this is the all what we are looking at. Over to you, Dr. Anmesh.
Thank you, Dr. Satish. It's a pleasure and honor to be here, and I thank you as well as Wolters, Kluwer, Ovid, and Dr. Ms. Ramya and team for having me here. I hope I'll be able to address the queries that you have raised. I have tried to make it, you know, in such a way that it justifies the title, demystifying. Okay, and as you have rightly said, it's not necessarily just DNB. In fact, it could be for any research, any thesis. But of course, today we are focusing on DNB, so I will be referring to those DNB guidelines given by the NBE. But generally, these guidelines are applicable for almost any research, including we have MDMS programs there also. Most of these things are similar, except for the specifics, which I will show you, and I will tell you what NBE expects in certain things. So that also I'll do. I hope I'm audible, and then my slides are also visible. Could you please confirm? Right. Thank you. So let's begin. And I am told that there is a mix of crowd. That is, there are residents who are fresh joinees who have just started their journey. There are also who are completing their journey and probably intermediate. So what I have tried to do is, from my interaction yesterday with Dr. Satish, I have tried to balance both the things. That means I'll give you some food for thought for all kinds of audience. I will be including things on protocol writing, and I will also share how exactly you should go when you already have conducted your research, and how do you present, and how do you show your results, and how do you discuss. Of course, both the things I have tried to balance, and since it's a session of 1 hour where I speak only for about 45 to 50 minutes, giving you some 10 to 15 minutes to raise your concerns and questions. So that's how I have planned. So please feel free to, ask your questions in the chat, as Ms. Ramya has already said. So going forward, these are the learning objectives that I propose for this session. So at the end of this session, as a participant, you shall be able to appraise the importance of learning research methodology. As Dr. Satish said, why this thesis, why research? Describe the features of a good research question, which is very important, as you will learn when I go forward. Formulate aim and objectives for a chosen research topic that you have. List the components of a research protocol and describe the steps involved in developing a protocol, and describe the structure of a thesis report once you have already conducted the research. Now, these are the objectives. But just to simplify, this is what I'm planning to do. So this is how my layout would be. First, I will tell you a few things exactly why should we have research, why should we have thesis in DNB program? Because you must be thinking, we are all doctors, we are health professionals. Why should we bother about doing research? We are, training ourselves to look at patients and treat them and diagnose them and whatnot. And how do you go about, once you're, taking up this program, how do you go about taking a thesis topic, or for that matter, any research topic? How do you go about from that topic to formulate a particular question, which is called as a research question? And how do you develop your aim and objectives? Once you're done with that, how do you develop a protocol? Because that's the first step. And you develop that protocol, you go for uh, approval by the ethics committee, you get various other approvals. And then, of course, as a DNB protocol, you will also have to put up in the DNB so that DNB board approves that, and then you go forward with this research. Once you're done with that, now after a couple of, say months, or rather about 2 years or so, you'll have your data collection over. Now you are going to analyze and present your data and discuss that, and then bind it in the form of a thesis, which has to be submitted again to the DNB board. So this again will give you an idea about how to go about doing that. So first of all, why thesis? Why should we have thesis? Any ideas, any thoughts on that? Anybody wants to put on chat, maybe, quickly, if anybody, and maybe I could request Ramya or somebody to tell me if some responses have come. All right, so while we warm up, pardon me, I I don't know whether this was a response or a disturbance. Anyway, so going forward, so this is a quote from, President Kennedy of US. He said, people look at things and say or ask why, but I look at things and as they never were and ask why not. Okay, so we might say why thesis, but why not thesis? If I turn a little and twist this and say, and the other thing is, there are so many things that we come across in healthcare. Why not look at those things and then see why not, this is possible? Why is this going to be like this only? So that's another thing. And if you look at it, we have evolved over a period of time. So in the evolution of medicine, now we have come to an era of evidence-based medicine. And we also know that unlike many other pure sciences, medicine is not an exact science. That means it's not that 2 plus 2 always equal to 4. In a patient, the same drug may work differently compared to another patient. Same kind of treatment, same kind of things may work differently. There are so many other variables involved, the physiology, the kind of, the reactions you might see. So all those things. So that's why we need to have research to figure it out. And of course, human beings in general, and we healthcare professionals and doctors in particular, are always in a constant quest for improvement. We want to be better than what we were. Thesis or research also lays a strong foundation. How? Because you get an idea of the whole thing, and then it also helps us to understand what is published in the literature. Because nowadays, even the pharma company representatives and the medical representatives, as we call them, they are very strongly armed with the literature, so-called literature. They'll come and say, sir, this is a RCT which was done. Now, there are chances that they are genuine, but there's also a chance that they are not very good, or the studies they show you are not of rigor. So you need to know how to separate the wheat from the chaff. And that's where this knowledge helps you. And of course, if any of you become consultants and academic medicine you go into, so you'll have to guide the future postgraduates as well as youngsters. And in that case, you have to have knowledge. You can't say that I do not know. And any of you having aspirations to go abroad, this again is a very, very important area, because this gives you an additional edge and advantage. And if you happen to be in a position where you can influence the policymakers to formulate policies, or you happen to be in the seat where you have to make policies, again, research gives you an idea and evidence to what works and what doesn't, and also what to take forward. There have been, various articles. I'll just quote 2 or 3 of them. So the Indian Journal of Ophthalmology not so long back actually ran an editorial on why learn research methodology, and they go on to elaborate and they say that no, in this era of evidence-based medicine, all decisions regarding whether it's investigation, diagnosis, or treatment, we take it based on the research, so that improves our outcomes and everything. And similarly, in National Medical Journal of India, we had this article by uh, Dr. Anand Krishnan, who also says that MDMS, in that program, the dissertations we must have. Now let's go to what NBE says. For NBE, research exposure will be helpful in improving problem solving capacity, getting updated with the ongoing research, and implementing these findings in clinical practice. So if you see, all connected. One, we become better at solving problems. So if something we are faced with, let's look at pandemic. The onset of pandemic, we most of us were not really sure of what it was, what we were faced with, how to handle it. But as time progressed and people reported things, people started talking about their experiences. We have so much of literature now, so we know that how to go about, and we are much better worse, and we could handle things, of course, with certain abilities and experiences, and then of course with the building of knowledge. Then it helps us in our clinical practice as well. Now, many a times this is the question, okay, fine, but what should be my thesis topic? How do I go about? So you can get ideas from multiple places. If you are thinking of looking at the literature, the medical literature, journals, and the latest things, you can get. If you are attending scientific meetings, CMEs, conferences, and there you will get ideas because somebody would have presented something, you listen and you get a spark and you say, okay, let me try a little variation from that, not just copy paste. Sometimes when you're interacting over a cup of coffee or otherwise, and you're talking to people from different specialities, and then you will get an idea that, okay, suppose somebody from, say, pathology interacts with a radiology resident or a radiology faculty, and they'll say, hey, listen, I came across this particular tumor, and don't you think that without doing a biopsy, can we not do a imaging or something, and then, or can't we have a marker, the other person says. And so you'll say, okay, but what are the chances? How sensitive is it? How specific is it? Can we really do it? So again, you need to do a research to figure it out. And then sometimes these funding organizations come out with their own thrust areas. So if you're planning for that, you can look at that as well. And then even for DNB and MDMS programs, we have the ICMR grant for thesis itself. So they call out twice in a year. So you can look at that and then try for that as well. Sometimes you might have done some previous work, a small work, or and you want to expand, you want to go ahead and then do something and then see that how exactly it goes forward. So you could do that. And very importantly, sometimes in your routine practice, or maybe your consultants have observed something and they want to look into that. So that itself will be a good idea to start off from there, and being imaginative and inquisitive. So again, that gives us some ideas. Another thing is, when you are reading the articles, have some skeptical attitude, have a questioning attitude. So when you do that, automatically you get ideas. Now that brings me to, so how do you go about from there to a research question? So please remember, research question is something which is used to analyze and investigate a topic. So it's written in the form of a question, and that's why it's called a research question. It's inquisitive in nature, but it has to be clear and concise. And you should be able to formulate in such a way that it gives me an idea about what is the population that I'm going to study, what are the variables, what is the purpose of this. And for this, it's a good idea to start off with a broader and narrow it down. So start with an issue that interests you. It could be even sometimes, a broad theme, and then you go into a specific question or a query, and then see to it that when you are asking that question, there should be ability to answer that question. It should be within the scope, within the feasibility aspect. It should not be too broad or narrow. Now, I'm just showing you some. Look at this, and these are, this is from my own institution, pediatrics department. This is a postgraduate dissertation, MD pediatrics. So can flip chart assisted maternal education improve essential newborn care knowledge and skills? A randomized control trial. So this was just to see that if we deliver this information using a flip chart, and you had a comparison as well. So go by this and then compare and see that whether that really helps or not. And this is something which was from the experience that they had, they decided to go with this. And they said, okay, let's do this as a research and figure it out. This is another one, which is again a postgraduate dissertation. So does preoperative rehabilitation give better short-term results in anterior cruciate ligament reconstruction? So this is from orthopedics department, again a PG dissertation. So this again was from PG dissertation. This is another thing which Akash is now a MD medicine, but this was done when he was an undergraduate student. You can see that. So he did this because we found that malaria is endemic in Mangalore, and we wanted to look at how does it compare between those who are from outside and those who are from the region itself, and are there any populations and then areas where there are hotbeds or hot pops up. So that's what we wanted to check. This is another two of my students when they were undergraduates. Now they are in the US, both consultants. So perception and practice regarding infection control measures among healthcare workers in district government hospital. Now this will give us an idea. This is just a basic study, but then cross-section study. I took you from RCT to others as well. So here this they wanted to know, and then how can we do something about it if the knowledge is not good or it's poor in a particular group. So this is how we go about. Now, how do you go about selecting a question, research question? So first of all, it should be something which is of interest to you as well as your guide, because you are the people who will be involved. Is it relevant? So relevant to that particular discipline, relevant to the people that you're targeting, or maybe to the population in general. And after having answered that in affirmative, you need to see whether it's feasible within your own reality. That means, do you have the resources? Do you have the time? Do you have the availability of whatever you need for, suppose, certain tests, or maybe the number of patients required? Now you have very limited number of patients of that particular disease. You cannot really think of doing it, because then you may not have the numbers to justify your results. And is the progress possible? Do you have the access to data? If you do not get to access the data, then there's no question that you can do that. Is literature available? Now here, please don't get swayed by that every time literature has to be available, because sometime when you do something for the first time, you may not get a literature available. That's okay. That's okay. But whatever concerning that or something related to that is available, please project that. And then see to it the feasibility, the resources, and is it going to be beneficial? In short, if you can remember this mnemonic, finer, that is it feasible? Is it interesting? Is it novel? Now, what do I mean by novel? Novel means novelty is new. Now, you must be wondering, how can everybody do new every other day? So novelty could be in some ways or the other. It could be a new population. It's a different set of population. It could be, if you are looking at a particular technique, is there a modification or something that you have done? It could be anything. So you look at that, and then that becomes a novelty. It could be that probably in this region, it has not been done at all. So you want to add to the literature. It has to be ethical. It has to be relevant, relevant to the field, relevant to the people, relevant to the discipline that you're catering to. Another way is to look at it from the point of view of PICOT framework. People used to call it PICO, PICU. T is also added. I'll come to that. T is basically the time. So this is useful in framing a question, a research question, which is a clinical research question. So it helps us. How does it help us? Because it gives us some clarity, and there is a relation between the different elements, so that brings out very well. So PICOT stands for, P is patients or participants or the population that you're looking at. So please keep that in mind. Then I is the intervention or the indicator. If you have an interventional study, so you'll have an intervention that you're planning to do. Or what is the indicator? Suppose I'm looking at probably looking at something like a marker, or if I'm looking at a lowering of blood pressure, or say for example lowering of intraocular tension. So that is my indicator. What I do is my intervention. And do I have a comparison or a control group? Sometimes there is a possibility you may not have a comparison group. So in that case, you might go with historical or literature. So that is also possible. And what is the outcome that you're looking at? So what exactly? So define that outcome. And obviously, this has to be time bound. You can't have forever, especially when you're doing a thesis. Definitely, it has to be within the times lines that are specified. So this is how you frame it based on PICOT. So if you see, we say in so and so population or participants, does this intervention compared to a comparison or a control result in this outcome in this time frame? This is how the broad structure. I have put those as a fill in the blanks thing so that you get the structure. I've given you an example below. So if I say that based on that framework, I say in healthcare workers, so that's my population, what communication strategies result in more effective communication with clients with a hearing disability? Now, if you see, I don't have a comparison here. But if I want to really add a comparison, I could say that, okay, in healthcare workers and does, what kind of communication strategies result in more effective communication? And I want to say that compared to some other strategies, or even I can have sometimes clients who are with hearing as disability and some other. So I could do that. I'm giving you another example. Now, for example, I say that there are patients who are undergoing a ultrasonic scaling. This is from the dentistry side. So does pre-procedural boric acid mouth rinse result in reducing the viable bacteria and dental aerosols? So will this outcome be, seen if at all I were to use a pre-procedural boric acid mouth rinse? And once you have this in this way, you can formulate your objectives and then you can go on and do this research, analyze the data and answer this question. So this gives you a framework where you can make a research question like that. So again, I'm giving you some examples. Population of interest of, the patient. Or so, for example, if I say that preterm neonates, which are less than 32 weeks of gestation, or maybe neonates requiring umbilical arterial catheter, another population. So if I say preterm neonates, and this my intervention here could be delayed cord clamping for 60 seconds. So if I'm looking at preterm neonates with less than 32 weeks of gestation, and if there is a delayed cord clamping, does it, have a, say, compared to an immediate cord clamping, does it relate to incidence of or increase incidence of intraventricular hemorrhage? So that is the outcome I'm looking at. So I have got a whole picot now. So I am looking at children who are less than 32 weeks of gestation. My the intervention or exposure is delayed cord clamping. My outcome is immediate cord clamping. The comparator is that, and the outcome is intraventricular hemorrhage, increase incidence, I could say, and that becomes my PICOT example. So again, think of putting it in that format so it gives you some clarity. You can even have sometimes, some things you want to associate, or you want to see the relationship, the correlation, or you want to see what are the influence of certain things, or there are factors which are affecting something, or something, uh, is seen. For example, I say I say that, if I see this, this is a pathognomonic feature of something. So does presence of something mean, like, for example, the moment I see maybe Koplik spot, I say that it's measles. So something like that. So if you want to, or in COVID, the moment I see that maybe anosmia and with other features, is it that this means COVID positive? So that is something, if you want to investigate, you can even put it that way, and then you have to come out with your, protocol. So please remember, this is a very important thing, because the moment you have a very good research question, your whole research becomes refined and good. If you have a poor research question, your research is not going to be, the outcome will not be good. So it's very important that you start with a good research question, and that's how you go with, because that's the start. And when you think of a question, you should have something which is well defined problem and well understood. It doesn't mean that answers are already there. The thing is, you should define it well, you should quantify, you should have parameters, and that should be understood, and that clarity should be there. Now from there, let's move on to aim and objectives. So what do we mean by aim? Aim is the overall goal. That means the larger picture. But for reaching that larger picture, we need to divide it into smaller steps. So that's what is the objective. So measurable goals that need to be achieved to reach that aim. That is objective. And this should be achievable within the time frame that you have available. So that is very important. Please remember, when you write your objectives, it should be simple, clear, unambiguous, specific, and measurable. Now, measurable is very, very important. What do I mean by measurable? I should be able to say whether that has been attained or not. So it could be in particular ways defined. It could be a measurement, it could be a marker, it could be, lowering of something, it could be probably a cure rate, anything. But please remember, in your thesis, definitely keep your objectives limited. I would say 3, 4, maximum of 5. Why? Because whatever you put up, it should be answered at the end of study. So if you have too many objectives, you'll have to do too many things and then probably a lot of analysis. So keep it limited, because this is only an orientation and you are getting a hang of research. So keep your objectives limited. Now, another thing is, keep your objectives very specific. Don't be vague, don't be generalized. It should be specific. It should be measurable. It should be achievable. Because if you are not going to be having that attainment, your whole study is defeated. It should be relevant and it should be time bound. So if you remember the SMART mnemonic, that gives you the idea. So specific, measurable, achievable, relevant, and time bound. I'll give you some examples again to highlight this. So if I had a research question that what is the magnitude of, and this could be a very simple descriptive study. So I'm trying to say that, that I just want to know that what is the magnitude of typhoid fever in particular area in under 5 children. So my aim is obviously to study the proportion of under 5 children with confirmed diagnosis of typhoid fever. That's what is my aim. My objective would be to document the proportion of children with typhoid fever among total hospitalized children. And the secondary objective would be maybe rate of complications, mortality, other things I can put up. So see, I have limited objectives again here. So this is how I go with my research question to aim and objective. Let me again show you another kind of example. So when I'm doing a case control, that is a comparative two group study. Now, previous one would have been just a descriptive and a kind of a cross-sectional study. I don't have comparison groups. Here I have a comparison group. So I want to see what is the impact of malnutrition on clinical recovery in under 5 children with typhoid fever. So here I want to see whether there will be a different outcome in children who are malnourished versus normal. So here, this is my aim. Compare the outcome of typhoid fever in malnourished children versus the normal children. And my primary objective would be to compare the duration of hospitalization between undernourished and normal children with typhoid fever. And again, I can look at mortality and rate of complications. If I find one group having higher compared to the other, that during the analysis, and I can come out with my results, and I can say that. Again, another one is, I just want to know a particular diagnostic test. What's the role of that compared to any other test? So I could do that as well. And then I want to see what is the sensitivity and specificity, because this will help me to diagnose tomorrow. So again, this could be one of my objectives, and then I can do. So I have shown you in the same domain of typhoid, in the same under 5 population, I have got different questions, research questions. My way of doing the study varies, my aim and objectives varies. So that's why I've taken this example and taken you through. So I hope this gives you some understanding. Now, having said that, how do we go about writing the thesis protocol? Now, please remember, since we are focusing on DNB, so I have taken the latest guidelines which are available from the National Board of Examinations, and we'll go through that. First of all, what is a research protocol? So very simply put, it's a detailed plan of a study. And please remember, every protocol, every research should have a protocol, and it should be written, right? Because obviously you require it for multiple purposes, including submitting it to the DNB board to get your approval of ethics board, all that, right? So once you have the plan ready, you should follow that plan itself. It's nothing but, as the DNB board puts it, it's an operating manual for the whole, research. And it will have the background, research question, aim and objectives, and the detailed plan of study. So that is what is the thesis protocol as per DNB board. They've also specified, this is from the DNB board guidelines. So they've said that the title should be 20 characters, including the spacing. The synopsis should be 250 to 300. Synopsis is something like a condensed version, like an abstract. So synopsis is like a trailer of a movie. So synopsis, and then introduction will be 300 to 500 words. Review of literature should be restricted to 800 to 1000 words. Aim and objective should be up to 200 words. Material and methods is the most extensive section. Why? Because there you are trying to say how you're going to reach that goal. So 1200 to 1600 words are given for that. And then you also have to put references, which are restricted from minimum of 10 to maximum of 25 references. But please remember, whatever you do, it's very important to understand that you need the approval of ethics committee of your institution before you start. doing your research work. This is a plan, but this plan has to be submitted and approval sought from the ethics committee. Once they give you, then only you go forward. And these are the timelines for your protocol submission. So if you happen to be a 3-year DNB resident, that means you are doing a DNB without doing any diploma, or sometimes even post diploma, you join for a 3-year course. So 3-year course people have 180 days, that is 6 months from the date of joining, to submit their thesis protocol. For the 2-year course DNB trainees, it's only 90 days. Mind you, it's only 3 months. And for the commencement of research study, 181st day onwards you can start. Whereas in the case of the people who are joining for 2-year course or a post diploma course, those people will have 91st day onwards you can start off. What do you face if you do not really comply with those timelines? So obviously you will not be eligible to appear in the exam, and then you cannot submit the thesis without the protocol submission acknowledgement number. So all those things are there, and these are the guidelines latest July 2020 admission onwards. These are applicable, so please remember and follow this. Now let's go into the structure of protocol. So protocol consists of various things. As per the DNB board also, you need to have these things. So basically, you need to have a title page, an introduction or a background, a brief review of literature, which is recent and relevant. There should be aim and objectives, the material and method section, a timeline preferably. That's not the DNB guideline, but I would suggest that you have that so that it keeps you on track. References and any annexures that you plan for. So that will include your pro forma or questionnaire, any informed consent documents, permissions, etc. So all that. So let's go into one by one into those things. So title and investigator, it should be short and informative. I've given you the guidelines. So informative title, which gives us an idea about what's your objective, what's the population that you're planning for to study in, and if possible, the study design can also come in here. So that gives you a kind of, the idea about what exactly is being planned. So that's the idea of doing this as a, and then you will obviously put your name because you are the investigator, and your guide's name, the institution name and the affiliation and the university name and all that will also come here. So that is something which you need to put forth. I suggest that you put the version and date because it's a good idea to do that, especially if you're submitting it to the ethics committee as well as to the DNB board. It's a good idea to do that. Coming to background and introduction, it should basically give a the latest and what is the scientific justification for doing the study, what is available, are there any gaps and controversies about the topic that you've taken up, but keep it brief. And I've given you the guidelines again of number of words and other things. But if you can in short answer why you're taking up this study, that is the purpose of introduction or background. Moving on, aim and objectives. I've spent some time, so I'll not go into details, but please ensure that these things are done. Ultimately, this particular section tells us what is going to be studied or done in your research. So that is the gist of it. Coming to material and methods. Now this I have broken down into multiple. So start with study setting. Setting is where you're doing. Is it in your hospital? Is it in the school? Is it in the community? Is it, in a particular camp or something? If you're going by camp approach, so all that. What is the study design? So there are different study designs which we use in epidemiology. Put that study design. What is your study design? What is the population? And from population, so it may be that all the population which you're targeting or aiming at is your population, but you will be taking a sample from there. So how did you take that sample? What is the method and what's the sample size that you have? Again, you will have to take the help of statistician to look at what is the calculation of sample size. Put up inclusion and exclusion criteria. Here I want to just give you a tip. Don't put exclusion criteria. Suppose you've said those who consent and exclusion is those who do not consent. It's understood. I'll include only, patients in the age group of 12 to 18. So do I say that, anyone above 18 will be excluded, anybody below? It's understood. 12 to 18 become inclusion, then exclusion is otherwise. Then the study period, the variables that you think of, the outcome measures, if any, and the unit of measurement, because sometimes that can vary. So that if you have used particular definitions, so standard definition should be put forth. Classification, again, in diseases where you have multiple, this is very important because it's a good idea to put up your definitions and classification because then we know what we are talking about and how you have gone about in your thesis. And the data collection procedure, how would you go about after taking various approvals, how will the data be collected, analyzed, and of course the institutional ethics committee approval has to be put up. So in short, if you can answer how do you go about conducting this study, this is what is the purpose of materials and methods. Moving on, please don't forget the references. Now, again, DNB board says it should be in ICMJE style. What is ICMJ? International, Committee of Medical Journal Editors. In short, or otherwise, it's the Vancouver style which is to be followed. Please understand there are different styles, Harvard style, APA style, and all that. You just have to follow Vancouver style. It's very simple. You usually superscript and in the end you write that in particular order with numbers as they appear in the text when you have cited, and then in the end you list them in that order. It's very easy for you to get this because you can just go to Google, search for Vancouver style of referencing. There will be a document which opens up. It gives you a variety of ways of writing, references for any of the other things which are available. It could be a resource from the internet. It could be a newspaper article. It could be a lay press, anything, even something which has not been published like a dissertation. So everything, there are examples given. But please follow the prescribed style. Do not mix styles. So this was about protocol. Now let's assume that you had the protocol ready. Now I'll switch gears and I'll go to writing the thesis. And this will be more for people who are about to complete or they are, halfway through. So I would like them to pay attention. It would be also good for the freshers to look at because they can plan ahead. So again, I have followed the guidelines given by the NBE. So this is the guidelines. Now they say that, it should be maximum of 80 pages, including the text, figures, references, and extra certificates, anything and everything. It should be 80 pages. And they also expect you to print on both sides of the page and every page has to be numbered. Please remember your institutional ethics committee approval is a must. You must have that and that has to be annexed as well. A4 sheets are the ones which are supposed to be used and should not have any blank page in between. The recommended fonts are Times New Roman or Arial or Garment of size 12 with 1.5 spacing. This is generally, but if you're looking at, the references, that can be single spacing as well. So this is what they say. And again, they have said introduction about 2 pages, review of literature 10 to 12 pages, and discussion 8 to 10 pages. So this is what they expect us to do. And at the bottom of the table and figure, the caption should be written on the same page and start every new section in the new page. So suppose you're talking about aim and objective, that should be another page. Results should be next page. Discussion should be next page. So that's how it should be. And this is what they say. So first will be the cover page or the outer cover, and then you have these things. So title in the cover page, what are the things to be there? So cover page will have the title of your thesis, the trainee's name, the year of the thesis, the logo of the NBE, the name of the institute, and guide's name is optional, they say, as per their guidelines. And this is the layout. So title, there will be a declaration which has been in the standard format, the introduction, review of literature, aim and objectives, material and methods, which I've already talked about, so all that. Now comes the results, discussion, summary and conclusion, references and appendices. So let's go into some of these. Before that, I would like to just again draw your attention to what is the timeline that they say. So they say that, these are the timelines. So last date for, the submission will be 26 months from date of joining. OK, for 3-year course. And if you are submitting with a late fine or late fee, 10,000 rupees, 1 month is extended. For a 2-year course, it's, they say 15 months from the date of joining, and with late fee, it will be 16 months. So that is the timeline. Again, if you do not comply with this, you'll not be eligible and all that. Let's not get into that territory. Let's hope that everybody does it on time and does it well. So what about results? So again, this is what DNB board says. Results should be organized in readily identifiable sections. There should be a correct analysis of data which is presented with appropriate charts, tables, graphs, and diagram. Now, what do you mean by appropriate charts? So there are certain things which can be just written. So you just write and explain. There are certain things which are better expressed in table, like what I have shown you. Now, this will be too complicated to show it in a figure or a diagram. So this is why this is a table. So you have different variables, you have different groups. Now you see baseline after drug and at 1 minute, 3 minute and 5 minute intervals. So this is what is the value with, you have all those things which are shown, and this becomes much easier for somebody to see and look at. When you're presenting in the terms of figures, you can have bar graphs. Now, on the left, what you see is a simple bar graph. That is okay for certain things, but sometimes you might want to have a stacked bar graph. So in this, if you see, each of them itself has a comparison between the different group. So that is possible. So you can use a stacked bar graph, you can use a composite bar graph, you can use a simple depending on what's your need. Again, this is a very familiar thing, a pie chart. Now, if you see here, this pie chart here shows each of the pies. Now, please remember one thing before I tell you about pie. If you have too many things, do not use a pie, because then each slice of the pie becomes too less, or sometimes there are so many demarcations or small pies that it becomes difficult to actually interpret data. So when there are limited numbers, then you use pi. You should not have like 10, 12, 15 things and then you use a pi. Then it becomes very difficult. So this is one of the pies with the pies, the slices coming out. Now on the left you see it's a two-dimensional pie, a simple pie diagram. On the right you see a 3D. Now what happens here is in 3D, because of the visual effect, you see the back part, the hind part, it looks comparatively smaller, but if you see, it's a false thing. So in scientific presentations and reports, we prefer that you use a 2D compared to a 3D. Now again, this is a summary of how do you use different kinds of charts. So if you are having a comparison, and again, you can use things like bar and column, or you can use even a circular area line chart, things like that. If you want to show a relationship, you can use a scatter chart or a bubble chart. If you want to show a distribution, again, scatter chart can be used, or a histogram. Now the histogram is basically something like a bar, but it's continuous. And there you can even have a frequency polygon. If you want to see a comparison which changes over time, you can have a stacked column like I showed you. You can have even something like a static comparison can be shown with pie chart as well. So these are some of the things you can do. Coming to the discussion section. Now this is very, very important, because here you are going to show what you have found and what is the meaning of it. How does it compare with the others? So this is what the DNB board says that you should start by summarizing the results for primary and secondary objectives in the text form without giving the data. Don't repeat the results section. And then give a comparison of other things what has been found by others. So here you are trying to put the ideas about your research finding, consolidate, generalize, and interpret the outcomes. So you're trying to make sense of what you've found, and that is why it's important. So there are some pointers. Restate your results, but don't repeat them. So here you can say that we have found this, and this is how it compares with, or other workers earlier or in other parts of the world have found similar findings, or our findings are distinct because, and there could be possibilities because of this reasons. This is what. So comment on the result, evaluate your result, and based on this, you suggest what is the way forward or what can it be. This is the most original thing. So you need to have creativity. You need to have, some thought put into this. There are certain techniques, like you can have Swale's move step analysis. Example, this I picked up from the review of literature. So basically here, suppose you were to show some dance moves. The example given here was Macarena. Now you have to go in a particular sequence. So your hands have to be in, it can't be on the hip first. It has to be, extended first, and then you go in sequence, and then, so that is how you go about. So discussion has to go in that sequence in those way, and then it has to be in that order. The next approach is the compare and contrast. So what you do is you state your results and you compare and contrast with others. What there could be similarities, there could be contrast, and try to give an explanation for that. The other theory, what is for discussion, is the big machine of Howard Baker. What he says is, imagine that your result is like a big machine. You describe and you say how exactly it works, what does it mean, what are the parts and things like that, and that's how you go about. One more idea is null hypothesis. That means if you did not find these findings the way it is, what would it mean and what does it mean if you have found this now? So these are some of the ways just to give you an idea in the limited time that I have. So to sum up, research is important in medical and health sciences as we've seen. Understanding of research process helps in understanding the evidence and better patient care. And thesis is a very, very important method to inculcate research methodology training, especially in the youngsters who are taking up the profession. So I'll stop here. Thank you so much for your time, and I'll be happy to take questions. You may reach me as well if you feel like in future. So I'll be happy to connect. And now I can take some questions. Thank you so much.
Any questions, please do not hesitate. Please ask in this 10 to 15 minutes time. Anyone wrote in the chat box?
No, we don't have any questions in the chat box right now.
If there are any, I could take some questions.
Has questions?
I'm not sure if it was too much of overload of information, but
Uh,
I've tried to.
no.
Yeah,
Actually, Anmesh, it was a fantastic presentation. Actually,
thank you, sir.
I don't know how much it went into the brains of a resident doctors at DNB. For me, it's actually I learned a lot from this session.
Thank you.
Actually, yeah, we a lot of people doesn't have this complete knowledge of the thesis protocols and everything actually, but this has an eye opening for all the resident doctors. It's easy how you explained in your topic, like for simple you simplified a lot of things in this your session. Actually, I should appreciate the Wolters Kluwer team and you definitely, and especially Wolters Kluwer putting your knowledge ed series, skill series. So this is the beginning of our connect. We would like to do more sessions like this. I think this is the thesis. Then we can go on to research articles, case reports, how to publish in a journal. Those links I think we should do in next sessions. I think if you have any questions, please ask in this, or else you can reach him. He has mentioned his mail ID or phone number. Over to Wolfsburg.
Perhaps absolutely, sir. Because the thing is, as you said, actually, what I have tried to do is, as you said, simplify as well as keep it within the time this was allotted for. Because I want to, achieve both the goals. That is, keeping it simple, but within the time frame. I don't want to overshoot as well. And that was my idea. And I hope, this has been able to do that. The other thing is, as you said, sir, each of these things actually, and even writing the papers, that itself is because we do sessions on that, and recently we also did it with our undergraduate as an elective. We've been doing this program actually for almost 20 years, as you said, and I showed you some papers. You can find it on the many of the open access journals. We are publishing in very high quality journal as institution, as particularly as my department. So we've been doing this, and we recently reported in Indian Journal of Community Medicine last year, October to December issue, saying that 20 years of our experience with student research, undergraduate, I mean the MBBS student research. So we have some idea, and that's why we are able to, because we don't talk just bookish, we talk from our experience as well. So that's where we come from, and we have that fortune that we are associated with many things like this. So that's why I tried to break down. Of course, many of these things itself could be a session, maybe an hour or so. But
definitely,
having said that, within the time budget, I wanted to do justice for all kinds of the audience that we have, because it should address the freshers as well as somewhere intermediate and the ones who are at the fag end of their DNB. So that's what
no,
my
no. In
idea.
this
And
session,
I'm
I think in this session, some of the faculty and
yes,
administration people also are there. I
yes,
think
sir.
it was useful for them also to train their students actually.
No, I'm aware, sir. I was told, and yesterday you had told me, and Ms. Ramya had told me day before Mr.
Yeah.
Dinesh had told me.
Yes.
So that's
Yes.
what I kept in mind, that there will be some faculty also. So that also, because as you said in my introduction, I actually have had opportunity to interact with the faculty of Shankara Eye hospitals, and we had curated sessions for even the faculty, because sometimes they found that there were challenges in the faculty themselves. So they had a curated session which was attended only by faculty as well, and there we tried to look at their concerns and train them as well. So we understand that, and this also helps. But as you said, this is just probably a beginning of the relationship, and let's hope that we'll have more things, and we could do it even tailor made for the kind of objectives that you have in mind.
Yeah. Okay. Rajiv.
Yeah, so thank you, Dr. Animesh, for such an insightful thought. So now I would request my colleague Rajiv to take us through the Ovid DNBE resources. Over to you, Rajiv.
Thank you, Ramya. Thank you so much, Dr. Animesh and Dr. Suresh. Thank you for giving us time and joining us on this session. Dr. Animesh, you have beautifully explained on the PICO format, population intervention comparator and outcomes, beautifully explained the protocol thing and how to go about it. I seriously, every time I joined your presentation, I learned so much from it. So just to add on to that, once you are thorough with for the users, once you draft your clinical research questions, literature search plays an important role, and there comes a role of Ovid as well. So Ovid is providing you resources which will help you out to do literature searches, and I am sure that information about Ovid is already being shared to you, but just as we get an opportunity to interact with you all here, I would like to share it this place itself. So this is your starting point where we are saying you can visit this ovidsp.ovid.com/auto login to browse and see the content which is available to you. In this, there are two type of accesses available. Means by two ways you can access the platform. One is by using internet from the institution. In that scenario, you do not require any ID or password. But if you are browsing from home, then ID and password is required, which we have provided to your institution. You can get in touch with your DNB coordinators and maybe the library, and they will provide you the ID and password. So as I'm not in your institution, I'm not using internet from your institution. I'm just using ID and password here. How to start? On the first screen, you will get a choice like what exactly you want to do on this platform. So first section covers that you are able to search the content from your subscribed journals. So first option give you a subscribed journals content. But if you are interested in seeing the larger data, like for literature searches, meta-analysis, systematic reviews, then Ovid itself hosts more than 3,000 journals from different publishers on this platform, which is a good starting point for do a literature search. So today we will focus, as I have just 10 minutes of time. So I will try to give you very brief capsulated information, how you can reach out to the full text articles and what kind of searches you can perform. So here you can see once you are on this screen, use this first option to see the full text journal. Simply click on this. And here you will find we have different type of searches available. Just briefly, I will introduce the platform. This is use search history interface where whatever searches we will do, that will be recorded under this search history panel. And it has a lot of tabs, which is right now inactive, but eventually it will get active once we perform the searches. And these are very helpful and research focused and very powerful tools is been implemented within this Ovid platform, so which is part of search history. And then we have different types of searches available. It's not necessary you learn every type of searches, but you should know in which situation which search will give you the best results. And of course, if time left after our major discussion, then we will go to this journal tab where you can see the list of the journals at one place, what is available to you. So we'll start with this. So here we have 5 types of searches, starting from basic search, find citation, multi-field, advanced, and search fields. So let's begin with the basic search. When I say basic search, it's very strong and powerful in the sense it captures natural language processing. Like if even if you can search with just one word or an entire topic or entire research question, you can put into here as well. So today I will take some few keywords, maybe like let's take aorta aneurysm in children. If I want to see the content on this particular topic, here we have an option for multimedia content. As Dr. Animesh was saying, that it's good to use pictures, videos, graphs, graphical presentation. If you want to take references of any multimedia content, that can be easily seen under this include multimedia. So if you want, you can tick this box, otherwise keep it unchecked. Another box is include related terms. What does it means that if I'm using these keywords like aorta, aneurysm, and children, it will also give me not the articles on these keywords, but the related articles which are having a related keywords like aorta, aneurysm in children, like children's or anything. So I will show you those related words, how it captures. So that will give you more number of results. So very simple, just start with the search tab and we'll see how many results we will get here. And here I want to focus on one thing. This Ovid platform does not just cater to one specialty. Whatever DNB courses you have in your institution at the Medicover Hospital, you will able to find the content for each specialties in this Ovid platform. So we got 9,024 results on aorta aneurysm in children. So this is the search history panel. So this is our first search, and you can see a lot of options are coming here, and these tabs also get activated. So I will tell you the advantage of all these one by one. Okay, so here we got 9,000 results. Can anybody tell me like whether for this 9,000 articles, do we have full text access or just an abstract or a mix of it? If you are not able to post anything in the chat, you can unmute yourself and also speak up. You have the option to unmute yourself and you can ask or suggest anything. Feel free to unmute yourself and ask in between as well. Okay, so just for the information, everything which is coming here, 9,000 articles are full text, means you are able to completely download the PDFs. You are able to go to HTML format of it. This is coming from Journal of Pediatric Hematology Oncology. And you can see here, there are certain stars are also mentioned here. Now, what is the significance of these stars? As we put the keywords here, the content comes as per the relevancy, and there are different criterias involved. Like some of the criteria is like whatever keywords I have put in, how many times they are appear in the article, how closer they are appear in the article. So accordingly, we have given the relevancy to the articles. 5-star means most relevant articles. And similarly, if we got a little less like 4, 3, 2, as the star reduces, the relevancy reduces. So if I want to see the 5-star only, I can click on 5-star only and then can see from 9,024 articles, how many are. After clicking 5-star only, I add to search history so that I can see that 11 is the most relevant article on this particular topic. Now, what is the significance of it? It definitely gives you a direction where you can start your searches or reading of this most relevant article, and then you can increase, go to the next level, maybe for 4-star, 5-star. That ways you are able to read the most relevant articles and then save your time as well. So if I want to see full text, just click on Ovid full text. And you are able to read the entire article from here. And you will also find certain pictures. If there are any pictures or videos part of the article, you can directly export these pictures. You can either select one picture or two pictures, just select all, and then you can export to PowerPoint directly. So in that way, if you are doing certain presentation, projects, assignments, you can use these pictures immediately, and you know not to take any snapshots or screenshots like that. So you can simply download the pictures with all the information. Like whenever you are using any pictures, you need to mention the source of it. So it comes with all that details here. You can see these details, references are coming here, so you can easily use these pictures and references, article DOI number, everything is in place. So very simple to use. Now, another important thing is here you can, if I have just shown you this HTML format, but if you want to download as PDF, just use this article as PDF. And if you want to share this article with someone in your group, you are working in a team where multiple people are involved, then you can simply use this email jumpstart. Do not copy this URL from the top to share the article, because this is session based unique ID is given to this particular URL, which will remain active till the time you are on this platform. The moment I close this platform or log off from here, this URL will not be active for anyone whom you share this URL with. So better to share from this email jumpstart. From here, you can simply use this URL or simply put the email of the person. This URL will remain active forever. So easy. So that's one way of finding the content. On here, I was mentioning about the related terms. And as you can see, there are two colors reflecting here. One is yellow. Yellow is the exact keywords which we have used in our search. And purple is something which is related terms which we have not used exactly. Like we have used aorta, but here aortic is also captured. So that ensures that you have a broader view of the results as compared to what we will get with the exact keywords. Now, another important thing, as Dr. Animesh was mentioning about referencing of various Vancouver style and various styles which he suggested to use, and he was mentioning that Vancouver is the most preferred way. So like if you have basically selected an article which you want to use as a reference, you can simply select like this, and you need not to write it by yourself or the Vancouver style. Just select it, go to the export. Here you have Microsoft Word citation style. So it gives you all the choices, what citation style you want to choose: Vancouver, MLA, Chicago, APA, MLA, all of these. But as in this today's session, we have focused on Vancouver. You can click on Vancouver and export. Then the references and citation will definitely come directly in a Vancouver style for your ready use. So that is easily doable. Now, let's quickly talk about a multi-field search. In this, this is a wonderful tool where we can actually create a complex search strategy. Some complex search strategies like, let's take a hypothetical situation where I want to see articles on treatment of cardiomyopathy in children. So how to frame or find the content on it. So let's say cardiomyopathy, treatment, and children. I have divided that. And then adults. I'm choosing adults. Why? Because I want to exclude the results which are or articles which are talking about adults. So in that sense, right now what I'm doing is I'm combining cardiomyopathy plus treatment plus children. And when I'm saying plus, we are combining it with a Boolean operator like and, or not. So and I'm using here in the last way where I don't want to see results on adults, I will use a Boolean operator as not. Now it also gives me the choices here. As you must be knowing that the section or the parts of article has a lot of components of it, like abstract, title, keywords, author name, affiliations, all those things, summary, uh, results, like that. So if you are particular in finding the content from specific sections, like if I want those articles in which cardiomyopathy should appear in title, I can do that by using uh, these fields. So here, if I choose title, then it will pick up only those articles in which cardiomyopathy is appearing in a title of an article. Let's try this and see if we get any results here. Uh, so you can see here, we got 20 results for this particular keyword. And you can find here a cardiomyopathy is appearing in the title of each article. Let me quickly show you the comparison of it. Similarly, we will use the same keywords, but only difference which we will do here, we will choose not title, just all fields here. Okay, like that, and see how much results we will get now. So now we get 239 results. So my only purpose is showing these differences. You should be clear what exactly you want. There is a tools available to perform searches in a different way to get a different kind of results. So you need to visualize what you want to see. And especially in literature search, it's always advisable you start with a broader results and then narrow down it to your requirement. So it's good to go with a good number of results first, and then you can come down. Okay, this is another kind of search which we have covered: basic search and multi-field search. Let's quickly talk about find citation. In this, what happens? It's not necessary that every time you will come to Ovid platform. Sometimes what happens, we generally start our search either with PubMed, Google Scholar, or most of the time Google itself as well. So in that scenario, if you're finding some article which is part of Wolters Kluwer and you feel that, okay, I am able to see the abstract, but I need a full text of this article. So you can come to this platform, fill in the details, whatever you have of for article, like article title, author name, surname, page number, whatever, or simply the DOI. So if you have DOI like this, and then you can simply search. So if this is part of your subscription, or if you have a full text, then you can choose from here or fill in the details like this. So it's very simple to find a specific just one article from here. Now, after these three searches, let me quickly show you the search field also. As I mentioned earlier that an article has different components to it. Like you can see author, full text, issue, part, journal name, author keywords, DOI number. Right now, when I'm searching for keywords like aorta aneurysm in children, so where exactly I'm searching? I'm searching the entire, all fields basically. Okay. But if I have a requirement to search within a specific field of an article, I can come to this search field. Like for an institution, I want to search how many articles are published from India. So I just selected the institution and India and then search. So we got how many results? We got 3,426 results. Okay, here. But I want to see now this search history will give you a lot of advantages. Here you can combine two searches. Like earlier, we have searched for treatment of cardiomyopathy in children, not adults, which is 239 results. If I want to see within these 239 results, how much are published from India? So in total, we have 3426 titles or articles which are published. Out of this 239, let's see if there is anything from India. So what we are going to do, I just selected both the searches and combine it with and, so that it complies with the situation where it will suggest me all the cardiomyopathy criteria and India as a criteria. So total 4 articles has been published by Indian authors. So you can come to this complete reference sections and you can check. This is published by Sir Gangaram Hospital, New Delhi, India. Like that. So there are multiple options and ways to find out the content on this platform. Now, just one more minute I will take and then we will wrap it up. How to share this? Like today, I have spent 15 minutes producing these results for. Sometimes it's very important for researchers to show how you have reached to this particular results, what steps you have done. So if you want to share what steps you have done, simply use this copy search history link. What it will do, it will create a URL. So once you share this URL with any of the users in your institutions, they can easily come to the platform, authenticate themselves, and the system will run the searches automatically for them. They need not to search it again. This will be done by the system, and at the end, they will be able to see the final result, which is like 4 articles once all these steps are completed. Another important thing is you can also set alerts. Today, I'm working on this topic and I want to continuously keep updated that what new articles is getting published on this particular search or criteria or topic. So you can actually select all and you can save all, and then you can create your personal account to save these searches and set a frequency in what frequency you need an alert. Okay, so if you the user ID and password which you will get from your library, that is only for browsing. But if you want to save anything personally, then you need to create this account. Okay. So with this, I think more or less we have covered. Just to show you the last journal tab here, all the journals are listed which are available to you. Around 100 plus journals are part of it. 170 plus journals are there. So you can have a total list of the journals from here, and you can also filter by subject as well. So that would be all from my side. Over to you, Ramya, or if there is any questions, I'm then more than happy to help you out.
Any questions? Well, thank you, Rajiv, for abiding to the timelines. And I would really, once again, thanks Dr. Satish for giving us this opportunity. Thanks everyone for attending our webinar. We hope you all enjoyed our session. If you missed out or couldn't attend our session, please click on the link below for the recording, or we will be soon sending you the recorded video of webinar for your reference. So thank you once again and have a great day ahead. Thank you, everyone.
Thank you, everyone.